Right now, your blood is deciding whether to stay liquid. It makes that decision continuously, every second, in every vessel you have. Most people picture clotting as a repair crew that shows up after you get cut. That is backwards. The machinery is already assembled, already loaded, and already trying to fire. What stops it is the wall of the blood vessel itself, holding it back every moment of your life. So, what is the wall actually doing to keep your blood liquid? What happens in the 2 seconds after that wall is broken? And why does the same system that saves you from bleeding out also cause strokes? Start with the pieces that are floating in there. Your blood carries more than 1 trillion platelets. They are not really cells. They have no nucleus. They are fragments torn off from giant cells in your bone marrow called megakaryocytes and released into the circulation as tiny sealed packages of chemicals. Each one lasts about 8 to 10 days. Then it is cleared out and replaced, which means the entire population turns over roughly every week and a half, whether you needed a single one of them or not. Now the surface they are flowing over. The inside of every blood vessel is lined with a single layer of cells called the endothelium. The endothelium is the non-stick coating of your circulatory system. And non-stick is not a metaphor here. Those cells actively release chemicals whose only job is to tell platelets to stay away. Nitric oxide, prostacyclin, a molecule sitting on the surface that grabs the main clotting signal and switches its function from clotting to anti-clotting. Your blood is not liquid because clotting is off. It is liquid because clotting is being suppressed chemically, continuously, along every inch of that lining, which is why the moment matters so much. Now break the wall. A cut, a torn vessel, a crack in a plaque. The endothelium peels away, and 2 things underneath it are suddenly exposed to the bloodstream for the first time. The first is collagen, the structural rope in the tissue underneath. The second is a protein called tissue factor. Tissue factor is the trigger. It sits outside your circulation at all times, and blood is never supposed to touch it. The first platelet arrives within a second, but it cannot grab the collagen on its own. Blood is moving too fast, and in an artery, the shear force would rip it straight off. So, it uses a bridge. That bridge is a protein called von Willebrand factor. Von Willebrand factor is a long molecule that unrolls under fast flow and catches platelets like a net. The faster the blood is moving, the better it works. This is one of the few systems in the body that gets stronger the harder you push it. If you want the rest of what your blood is doing right now, subscribe. Once a platelet is anchored, it changes. It goes from a smooth disc to a spiked shape covered in arms. It empties its packages into the surrounding blood, and those chemicals do one thing. They call in every other platelet nearby, which then anchor, change shape, and call in more. Within about 20 seconds, there is a soft gray plug sitting in the hole. That plug will not hold. It is platelets stuck to platelets, and blood pressure will push it straight out. It needs to be reinforced, and that is a completely separate system. Tissue factor has already started it. What happens next is called the coagulation cascade, and the word cascade is doing real work. Each step is an enzyme that switches on the next enzyme. One activated molecule can switch on hundreds. Those hundreds switch on thousands. It is amplification, built deliberately into the design, because the starting signal is tiny, and the response has to be enormous, and it has to be fast. About a dozen proteins are involved. Most of them are made in your liver and float in your blood already, doing nothing, waiting. The cascade converges on one enzyme. That enzyme is thrombin. Thrombin is the switch that turns liquid blood into solid blood. It takes a soluble protein floating everywhere in your plasma, called fibrinogen, and clips it. Clipped, it becomes fibrin. And fibrin does not dissolve. It polymerizes into long strands. The strands cross over each other and weave into a mesh. The mesh traps red blood cells, and it locks the soft platelet plug into a solid clot. Then the clot tightens. The platelets inside it contract, pulling the mesh inward like a net being drawn closed, squeezing fluid out and dragging the edges of the wound together. A clot that has retracted is roughly 40% smaller than the one that formed, and under it, the endothelium begins to grow back. So watch the whole thing on a clock. At 1 second, the first platelet sticks. At 20 seconds, the soft plug is in place. Somewhere between 2 and 6 minutes, fibrin has locked it solid. Over the next hour, the clot retracts and hardens. Over the following days, it is dismantled from the inside. Because a clot is temporary, and that is the half of this that almost nobody talks about, your body has a second system whose only job is to destroy the first one. Trapped inside the fibrin mesh, mixed into it as it forms, is an inactive protein called plasminogen. The damaged tissue releases an activator that converts it to plasmin, and plasmin cuts fibrin apart. The clot is built with its own demolition crew already sealed inside it. The fragments that come off have a name, and if you have ever been sent for a scan to rule out a clot, you have met it. It is called D-dimer. D-dimer is a piece of dissolved fibrin, and finding it in your blood means a clot somewhere formed and is being broken down. Now everything above is the system working. Here is what happens when it fires in the wrong place. There are 3 ways to make a clot that should not exist, and they were described in the 1800s. Slow the blood down, damage the vessel wall, or make the blood itself more likely to clot. Any one of them raises the risk. 2 together is much worse than 1. Slow flow is the one most people can picture. Blood pooling in the deep veins of the leg, in a long flight, in a hospital bed, after surgery. There is no wound and no bleeding to stop, but the concentration of activated clotting factors builds up in the stagnant blood instead of being washed away, and eventually it crosses the threshold. A clot forms in a vein that was perfectly healthy. And a clot in a leg vein is not dangerous where it is. It is dangerous because of where it goes next. It breaks loose. It travels up the vein into the right side of your heart and out into the pulmonary artery. And there it wedges because the vessels of the lung branch down to a size it cannot pass. That is a pulmonary embolism. The heart is the other route, and this is where it connects to something we covered before. In atrial fibrillation, the upper chambers of the heart stop contracting properly and start quivering instead. Blood no longer gets cleanly pushed through. It sits. And in a small pouch off the left atrium, it sits long enough to clot. When that clot leaves, it does not go to the lungs. It goes up into the arteries feeding your brain. That is one of the most common causes of stroke, and it is the same 3 conditions in a different room. Which explains the drugs. Aspirin does not thin your blood, despite what everyone calls it. It permanently disables one enzyme inside the platelet. Without that enzyme, the platelet cannot make the signal that recruits other platelets, and it never recovers because a platelet has no nucleus and cannot manufacture a replacement. The platelet is crippled for the rest of its life, which is why the effect of one dose lasts for days, not hours. You are not waiting for the drug to leave your body. You are waiting for your bone marrow to build new platelets. The other family works on the cascade instead. Several of those liver-made clotting factors need vitamin K to be finished properly. Warfarin blocks the recycling of vitamin K. The factors still get made, but they come out defective, and the cascade runs slower. That is also why the dose is so unforgiving with warfarin, and why the vitamin K in your food changes it. And when a piece of this is missing from birth, you can see exactly what each part was holding up. Hemophilia A is a shortage of one single clotting factor, number 8. Not the platelets, not the vessel wall. One protein out of about a dozen in the middle of the cascade. The platelet plug still forms normally in these patients. It just never gets reinforced, so it fails hours later and the bleeding restarts into joints and muscle long after the injury looked closed. One missing link out of a chain that has maybe a dozen, and the whole reinforcement stage collapses. So think about what your body is actually doing. It maintains a system powerful enough to turn liquid into solid in seconds. It keeps that system loaded at all times, everywhere in your body. And it prevents it from firing using nothing but a single layer of cells, one cell thick, releasing chemicals continuously along a surface that, in an adult, covers thousands of square meters. The remarkable thing is not that clots happen. It is that they almost never happen when they should not. But that raises a question about the surface itself. If that one layer of cells is the only thing standing between you and clotting everywhere at once, what happens when the layer starts to fail? Not torn open by an injury, just slowly, quietly damaged year after year. That is the beginning of a plaque. And that is a very different story.